So, hello and welcome all. Today we will discuss about the topic drug for management of type 2 diabetes mellitus. So, let's get started. So, how can we consider person is a diabetic? So, if the fasting blood glucose level exceed more than 126 mg per deciliter, and when postprandial glucose level exceed more than 200 uh, mg per deciliter, and when HbA1c level exceed more than 6.5%, then we consider that the person is a diabetic. So diabetes mellitus is a metabolic disorder characterized by the hyperglycemia, glycosuria, and ketonemia. So this is about the diabetes mellitus. So diabetes mellitus is divided into two types, type 1 and type 2. Here we discuss only about the drug used for the management of type 2 diabetic mellitus. So in what happen, type 1 is insulin dependent and the type 2 is the non insulin dependent diabetes mellitus. So what happen in type 1? In the type 1 there is complete destruction of the beta cells, whereas in the type 2 there is decrease in the sensitivity of the insulin. So in this we have drugs which are used for the hypoglycemia, means with the drugs which are used for the management of type 2 diabetes mellitus. So let's get discuss these drugs. So in these drugs we have a three class. That is, first class is in drugs which enhance the insulin secretion, and the second class of a drug which overcome the insulin resistance, and the third class is miscellaneous anti-diabetic drug. Remember guys, we have three class, and in each class we have a different category of drugs. So let's discuss this class one by one. So starting with the class A, drug that enhance the insulin secretions. So in this class we have first category is sulfonylureas drugs. So it is divided into first generation and the second generation. In the first generation we have drug like tolbutamide, and in the second generation we have drugs like glibenclamide, glipizide, gliclazide, glimepiride like drugs. So second category in this we have Myelin Analog. So in this category we have drug like lepaglinide, nadglinide like drugs. So third category is Glp One Receptor Agonist, that is glucagon like peptide 1 receptor agonist. So in this category we have drug like exenatide and liraglutide. So next category is DPP4 inhibitors. DPP4 means peptidase 4 inhibitors. So in this category we have drugs like sitagliptin, sasagliptin. So this is all about the class A. So next is class B. So in the class B we have a drug like which overcome the insulin resistance. So in this category we have so in this class we have two categories. First is bigonides, second one is thiazolidine. So in bigonides we have metformin like drugs, and in thiazolidine we have pioglitazone like drugs. So next class C. In class C we have a miscellaneous anti-diabetic drug. In this class we have a four categories further. First one is drug which is alpha glucosidase inhibitor. So in this we have drug like acarbose, maglitol, voglibos. So second category is Myelin Analog. In this we have a drug is pramlintide like drug. So third is sodium glucose co-transporter, that is Sglt2 inhibitor. In this we have drug like dapagliflozin like drug. So fourth in this category is dopamine D2 receptor agonist. In this we have bromocriptine like drugs. So remember here that we have three class of a drug. First one is enhanced insulin secretion, second one is which overcome the insulin resistance, and the third one is miscellaneous anti-diabetic drug. So in each class we have a different categories of drugs. So let's get discuss this drugs or a class one by one. So first class is drug that enhance the insulin secretion. So in this class, first category is sulfonyl ureas. So in sulfonyl ureas, we have first generation and the second generation drugs. So the mechanism of action of this drug is that these drugs will block the ATP sensitive potassium channel, so that the potassium will not be able to come inside the cell. So there is a depolarization of a cell, and after that the calcium will come in and they will release the insulin. So this is the mechanism of action of these drugs. So all the sulfonyl ureas are well absorbed orally, and their plasma protein bounding is more than or equal to the 90%. So in this category drugs like tolbutamide, which is a first generation anti-diabetic, and glibenclamide, glipizide, gliclazide, and glimepiride, which is all the second generation drug. So all these drugs, this is their plasma half life and the duration of action. Like tolbutamide has plasma t half around 6 hours, and glibenclamide has plasma t half around 2 to 4 hours. Same glipizide has 3 to 5 hours, and then gliclazide 8 to 20 hours, and glimepiride has 5 to 7 hours. So this is about the plasma t half of these drugs, and this is the duration of the action. So here important point is to remember that tolbutamide is hepatotoxic. So the side effect of the tolbutamide is that it causes the hepatotoxicity, and gliclazide drug, which is second generation sulfonyl urea, it has additional action, that it possesses antiplatelet action. This is very important point, that gliclazide possesses the antiplatelet action, which is the additional action of this drug. So the common side effect of this drug is that it causes the hypoglycemia, it causes weight gain, or it causes a hypersensitivity reaction. So this is the common side effect of this first and second generation drug. So these drugs are contraindicated in the renal and the liver failure, because these drugs are metabolized by liver and excreted by the kidney. So this is about the first category, that is sulfonyl urea drug. So the second category in this class is Myelin analog. So in this category we have repaglinide and natglinide like drug. These drugs possess the same mechanism of action like sulfonyl ureas. Like this drug will inhibit the potassium sensitive ATP sensitive potassium channels, and due to which the potassium will no go into the cell. So this will cause the depolarization, and due to which the calcium will go inside the beta cells, and then they will release the insulin. So in this way this drug manage the insulin. So this drug, some of the point regarding this drug is that these drugs are less potent as compared to the sulfonyl ureas like drug, and these drugs are short acting drugs, and these drugs are mainly used in postprandial hyperglycemia. And remember, the side effect and the contraindication of this drug is same like the sulfonyl ureas, but except the hypersensitivity reaction. This drug do not cause the hypersensitivity reaction. Only the sulfonyl ureas will cause the hypersensitivity reaction. So next category in this class is GLP One Receptor Agonist, that is glucagon like peptide 1 receptor agonist. So in this drug we in this category we have drug like exenatide liraglutide. This drug is given by subcutaneous route. So GLP-1, it is an important incretin that is released from the gut in response to ingest the glucose, and it also inhibit the glucagon, which is released from the alpha cell, and it also slows the gastric emptying time and also suppress the appetite. So the important point for the GLP-1 receptor agonist, that all these drug in this category will cause the weight loss, and this drug has additional benefit, that is related to the cardiovascular benefit. Only the liraglutide in this category will possess this effect, and the side effect of this drug, that is exenatide and liraglutide, it will cause the nausea, and it will increase the risk of hypoglycemia when it is used with the insulin secretagogues, especially with the sulfonylureas. So this is about the GLP-1 receptor agonist drugs. So next, fourth category is dipeptidyl peptidase 4 inhibitor. So in this category we have drug like sitagliptin, sasagliptin. So this is the mechanism of action of these drugs. This is GLP-1, that is glucagon like peptide 1. So we know glucagon like peptide 1 is an incretin which is released from the gut in response to ingest the glucose. So after their function, GLP-1 will get metabolized, with the help of this enzyme, that is dipeptidyl peptidase 4 enzyme. So if the GLP-1 will get metabolized, so that they will not perform their function. There is drug like sitagliptin and sasagliptin. This drug will inhibit the DPP4 enzyme, so that the GLP-1 action will be increased. So this drug will prolong the endogenous GLP-1 action. So the side effect of these drugs is that it causes the pancreatitis. So this is all about the class A drug. So next is class B drug, that is drug which overcome the insulin resistance. So in this category, first one is biguanide. So in this category, drug is metformin and fenformin. Fenformin is not used nowadays; it is banned drug. So the mechanism of action of metformin is that it will inhibit the glucogenolysis, and it will also inhibit the gluconeogenesis. So, and here the point to be remembered, that it is a weight neutral drug, and it do not causes the hypoglycemia. And the side effect of the metformin is that it causes the lactic acidosis, it causes diarrhea, and it causes nausea. And there are some other uses of the metformin, like it is used in PCOS, like PCOS stands for polycystic ovarian syndrome, and it is also used in HIV associated metabolic syndrome. So this is about the biguanides. So in this class, that is overcome the insulin resistance, second category is thiazolidinediones. So in this category, drug is pioglitazone. So this drug will decrease the insulin resistance and enhance the glucose utilization. What happen in this drug, that this drug will stimulate the PPAR gamma receptors, and this due to which there is decrease in the insulin resistance and enhance in the GLUT4 production. So in this way, there is increase in the glucose utilization. The side effect of this drug is periphery edema, CHF, and the weight gain, and it also causes the fracture in the female. This drug is contraindicated in the CHF and the liver disease. So this is about the class second drug, that which overcome the insulin resistance. Now the third and the last class is the miscellaneous drug. In this first category is alpha glucosidase inhibitor. So, so the mechanism of action of this drug is that there is a big carbohydrate molecule. It is broken down into a small molecules with the help of an enzyme alpha glucosidase. So, after the breakdown into a small molecules, this will get be absorbed into the body. So, this enzyme will break down the big carbohydrate molecule into the small carbohydrate molecules. So in this way, this drug acarbose miglytol or the voglibos will inhibit this enzyme, and after inhibition of this enzyme, there is a decrease in the absorption of the glucose. So this molecule, if this molecule will not be will not reabsorb into the body after the inhibition of this enzyme. So these drugs are useful in the prandial or the postprandial hyperglycemic condition, and the side effect of this drug, it causes the flatulence and the osmotic diarrhea. So next is Sglt2 inhibitor. In this, the Sglt2 stand for sodium glucose co-transporter. In this category, drug is dapagliflozin and canagliflozin. So all the glucose filtered at the glomerulus is reabsorbed from the PCT by the help of the SGLT2 co-transporter. So if we inhibit this transporter, the glucose will not reabsorb into the body. So basically this drug will increase the renal glucose excretion. So the side effect of this drug, it causes the UTI and hypotension. UTI means urinary tract infection. So this drug will cause the urinary tract infection and the hypotension as a side effect. So the next in this class drug is amylin agonist. In this drug is pramlintide. It is used by a subcutaneous route. So the mechanism of action of this drug, it will slow the gastric emptying time and it will decrease the glucagon. So the side effect of this drug is that it causes nausea. It will increase the risk of the hypoglycemia when especially when it is used with the insulin. It causes the weight loss. So this is all about the basic drugs that use for the management of type 2 diabetes mellitus. So you can refer Goodman and Gilman for more details. Thank you.